Picture this. It had been a hectic day, and as you make your way to your car, all you're looking forward to is going home and getting some well-deserved rest. When without warning, your heart begins to race, pounding against your ribcage with a frenzied intensity. It skips beats erratically, leaving you breathless and dizzy, wondering if each beat might be your last. Panic sets in as you clutch your chest, fearing the worst. Then, as suddenly as it came, things go back to normal. The scary scenario we just described can be what it's like to experience heart palpitations. In today's video, we are going to be discussing just that. Palpitations, what they are, and are they dangerous? Hi, and welcome to your wellness journal. Last week, we received a comment on this video asking us to talk about palpitations and how dangerous they really are. In the comment, user Cecily Cardew asked, "Can you please talk about palpitations? Are they dangerous? I am having a fair bit of them and I am a bit worried." Thank you for your comment, Cecily. And yes, we'd gladly talk about this topic for you. We'll answer Cecily's question at the end of the video and we'll give Cecily some recommendations on what she can do. But for now, I want us to get into a short discussion about what palpitations actually are and how you can best deal with them, possibly even stop them. If you want to get straight to the answer, it will be timestamped in the description box below. You can always go back and watch the rest of the video if you so prefer. Let's get stuck in and start by figuring out what are palpitations. Heart palpitations are the feeling of having a fast beating, fluttering, pounding, or irregular heartbeat. Key characteristics of palpitations are feeling like your heart is beating too fast, skipping beats, flip-flopping, fluttering rapidly, or pounding that can be felt in the chest, throat, or neck. It is also sometimes referred to as the uncomfortable awareness of your own heartbeat. So how do they actually feel? In addition to what we described in the intro, how palpitations feel is very subjective, meaning that how you perceive them may not be exactly how another will experience them. I asked a few of my patients to describe to me what palpitations feel to them in order to give you a broader idea of what it can feel like. First up is from a 55-year-old female with a history of hypertension. She said, "Mine feels like my heart is fluttering or has skipped beats. It can make my breath catch and it can be off-putting at times." Another patient, this time much younger, a 26-year-old male who suffers from anxiety disorder, describes palpitations as, "I get ones that take my breath away and it feels like my heart is trying to play catch-up because it has skipped a beat or two." Another female, this time in her 60s, who has been diagnosed with cardiac arrhythmia, said, "It really depends. Sometimes I feel like it's an irregular heartbeat, but sometimes it goes overboard and feels like I'm going into a full-blown panic attack. If it's that, I get out of breath and my legs feel like spaghetti." Then, a man in his 70s who has had palpitations since he was in his 40s described them like this: "For me, it's like my heart skips a beat or two, and then when my body notices, it's like my body freezes for a second to make sure I'm still alive or something." Another description comes from a man in his late 40s. He described it as, "I feel every single heartbeat way too much. I feel it in my chest without any exertion. If I have my hair hanging in front of my face, I can see it shaking a little bit with every heartbeat because my heart is working too hard." This next description may seem familiar because it is often what is experienced by people who have had palpitations. This comes from a woman in her late 30s who has been battling lupus for nearly a decade. In that time, her heart has taken a big blow from the autoimmune disease. She said, "For me, it feels like my heart is beating in my throat. It's very hard to explain, but it's almost like my heart is being tugged on and it's in my throat and not in my chest." I hope you found a description here that will match with what you feel whenever you have palpitations. If you don't see your symptoms described, do us a favor and write it down in the comment section below for the Wellness Journal community to learn from. Oh, and if you want us to talk about lupus and other autoimmune disorders, and there are a lot of these, you won't believe in how many ways your immune system can betray you. Let us know in the comment section below. Now, moving on to What causes palpitations? Palpitations can be caused by a number of factors. If I had you guess a top reason right now, I bet a good chunk of you would guess a heart condition or a related one like hypertension. But did you know the top cause of palpitations is emotional triggers? And this is backed by a lot of data, including those from Johns Hopkins Medicine. Strong emotions like stress, anxiety, or panic attacks can cause the release of hormones that speed up the heart rate, giving you the sensation of palpitations. If you suffer from panic or anxiety attacks, then chances are high that you also suffer from palpitations. Next on the list of reasons is again not heart disease related, it's lifestyle factors. One of the first reasons is strenuous exercise, and you might not be surprised by this next one: excessive caffeine intake from coffee, tea, soda, and energy drinks. There are even some coffee brands who play on the word palpitate, a reference to how common the connection is. You can also get palpitations if you smoke. Nicotine from smoking or tobacco products can cause the elevated heart rate, which is a classic hallmark of palpitations. Another lifestyle factor that leads to palpitations is alcohol consumption. The heart flutters can also be brought on by a lack of sleep or extreme fatigue. Lastly, palpitations can also happen because of dehydration. After lifestyle factors, the next most common cause of palpitations is hormonal changes. This is also why palpitations are more common in women than in men, because hormone fluctuations during the menstrual cycle, pregnancy, or menopause can bring them on. And then we get to the medical conditions that can cause palpitations. There are a good number of these, so we might not be able to mention all of them, but the most common medical conditions causing palpitations are: number 1, overactive thyroid or hyperthyroidism; number 2, low blood sugar or hypoglycemia; and then low blood pressure or hypotension, followed by fever or illness, anemia, heart problems like abnormal heart valves, cardiomyopathy, and heart failure; and number 7, abnormal heart rhythms or arrhythmias. I know some of these sound scary, but just because you have palpitations doesn't automatically mean you have these conditions. We'll get back to these in a little bit, but for now, let's talk about the last likely cause of palpitations, and it's number 8, medications and substance use. Before anything, I want to remind you, don't stop any of your prescribed medications without letting your doctor know. Now, certain prescription medications like asthma inhalers and decongestants can cause palpitations. The same goes for over-the-counter drugs like herbal supplements and diet pills. And illegal stimulant drugs like cocaine and amphetamines can also cause palpitations. As you may have noticed, heart palpitations can be triggered by a wide variety of factors, including strong emotions, lifestyle habits, hormones, medical conditions, and medications or substance use. Again, a reminder, don't stop any of your prescribed medications without letting your doctor know first. Also, while palpitations can often be benign, they can sometimes be a symptom of an underlying heart problem. As your nurse, I strongly recommend that you seek medical attention if your palpitations are frequent, prolonged, or occur with other symptoms like chest pain, dizziness, or fainting. Now, let's go back to Cecily's question. Cecily asked, "Can you please talk about palpitations? Are they dangerous? I am having a fair bit of them and I am a bit worried." Hi Cecily, I want to start by saying that I understand your concern about frequent heart palpitations. The good news is that while they can be unsettling, palpitations are usually not dangerous and are often caused by factors like stress, anxiety, caffeine, alcohol use, and hormonal changes. However, in some cases, palpitations may actually indicate an underlying heart issue, especially if accompanied by dizziness, fainting, shortness of breath, or chest pain. I recommend discussing your palpitations with your doctor, especially since you did say that yours happen frequently. Your doctor can assess your symptoms, take medical history into consideration, and order tests if needed to rule out any serious causes. In the meantime, try your best to reduce stress, limit caffeine and alcohol intake, and avoid smoking. Remember, while palpitations can be frightening, they are usually not life-threatening, but it's always best to get checked out by a doctor for your own peace of mind. Okay, now that we've answered Cecily's question, let me get into some steps you can take whenever you start experiencing palpitations. Number 1, try relaxation techniques like deep breathing, meditation, or yoga to help calm yourself and reduce stress and anxiety, which can trigger palpitations. Number 2, avoid stimulants that may cause palpitations such as caffeine, nicotine, alcohol, illegal drugs, and certain medications like decongestants and diet pills. Number 3, stay hydrated by drinking plenty of water, as dehydration can cause palpitations. Number 4, eat a balanced diet rich in nutrients, fruits, and vegetables to maintain proper electrolyte levels. Number 5, engage in regular exercise to strengthen your heart and reduce palpitations. Just be sure to talk to your doctor before starting any new exercise routine. An important reminder, you should seek immediate medical attention if your palpitations are accompanied by chest pain or discomfort, severe shortness of breath, severe dizziness or even fainting, severe headaches, and vision changes. Also, you should consult your doctor if palpitations are frequent, severe, or prolonged, you have a family history of heart disease or other medical conditions, your palpitations start to present in a new or different way, and if your palpitations are getting worse or happening more often. Your doctor can determine once and for all if your palpitations are harmless or a sign of a more serious heart condition that requires treatment. Again, while palpitations are usually not dangerous, it's important to rule out underlying causes and get proper treatment if needed. There you have it, our video on palpitations. We hope you found this helpful. If you did, consider subscribing and hit the bell icon so you get notified whenever we post something new. We usually have a new video up every Friday or Saturday. Oh, and if you haven't done so yet, do us a favor, like this video and comment below. This is a channel run by nurses, and our goal is to educate and help you make wiser medical decisions based on correct information. We are your wellness journal. Have a healthy day.